Hello and welcome to our Wednesday webinar. I'm just sharing the screen right now with everyone so they can see. Boop and boop. Thank you again for coming and making time in your day for this. We're really excited to share with you our intro to QMobile. Some of you already have this. It's been out there for a little bit, but there are a lot of new features and even more features coming this weekend. So we really wanted to give this high-level walkthrough, look at some of the customization, and show you what a win this is for your practice. So this product was created specifically to help practices have the information of the EMR in the palm of their hand. So what are we going to cover today? Let's get into what is QMobile, some customization, viewing and managing features, some important capabilities that are currently in the app and some that are coming, getting started, so how would you log in and get hooked up with QMobile app, and then some contact emails for questions you'll have after. Like every Wednesday webinar, please, if you have any questions throughout this presentation, feel free to put them into the Q&A field of this webinar. We will answer them and post them along with the video of this webinar, again, on our Wednesdays, our Wednesday webinar section of the triarchhealth.com website. You'll be getting an email also after this webinar within the next 24 hours that'll let you know that everything's been posted there. You will see the slideshow, the webinar recording, as well as the answers to all of the Q&As that you post. So don't hesitate, any question is a good question. So what is QMobile? It's an additional tool that we've created to support providers and practices within our Triarch family. So it is not a substitute or replacement for QSuite at all. There's some of the data is only viewable and cannot be changed or edited, but QSuite along with QMobile is what is really going to be big wins for practices. So the purpose of QMobile is really to give that mobility to the physician and staff, which can make the practice even more efficient and have a better overall provider experience. So all of these small wins we'll be talking about today that the app allows you to do are really impactful in the overall scheme of what your day-to-day, making that easier, and then also making that patient visit much more efficient. So before we dig into the meat of the app, I'm actually going to highlight a few things that are customized just for our physicians. So we really tried to capture the things that you will most use in this bottom toolbar. So if you click on home, you will see you can look up your patients in your patient list by patient. But if you click on calendar, this is a really valuable thing. You click on calendar and you can see your schedule, all of your appointments that you have in that day. Another great thing is from this calendar feature, you can click right on the name of the patient and it'll take you to their patient record. So that'll bring that up right away. When you click on activity at the bottom of the screen here, you'll see it brings up these choices. It'll have, you can view your tasks for the day that are outstanding, mark them completed, or if you have pending refills, if there are things that are waiting for your approval, you can click on that right there and approve with one click in the app, which is really fantastic. So everyone who has access, you can also, everyone who has access to QMobile can go in and customize your settings and also how you're viewing the app. So let me walk you through that. So the settings, you can enable touch. We also have Face ID now, which is fantastic, an added security measure. So you can decide whether you want that on or off. It's really great because it means when you log in for the first time, you'll enter your data and then you only have to do that once. Every other time you launch the app, you can use your Face ID or just hold down your thumb with the Touch ID and it'll open the app. You can also decide how many minutes you want it to take for your session to time out. Again, another great security feature that you get to customize. You also get to customize how you're viewing it. So which icons are even being displayed on the screen. So if you see here, the ones with a red X means they are currently viewable. They're visible on this toolbar. If you don't want to see it anymore, you click the red X and it goes away. Portal communication, you can see here, has a plus sign. That means it's currently not visible on the toolbar, but if you'd like it to be, you can click this plus sign and make it added. You can also hold down any of these icons and drag them and drop them wherever you want. So you can put them in the order that you're going to most use them, which is fantastic. Again, another increased efficiency here in using the app. So everyone can view within the app appointments, tasks, patient demographics, and even some messages that are in there. So if you're walking in with a client, you might be able to see the messages that your nurse sent you. You can see the history of the patient before you even walk in the room. If you're looking for lab results, you can see them here within the labs. And then at the end of the appointment, if you need to prescribe anything, you can easily, with one tap, bring up their medication history. So again, as easy as going in calendar and clicking on the patient name, that'll bring up all of these things, or from that home screen, you can put in a patient's name and bring up all of this as well. Really, really great stuff that you can view with a few clicks in your app. Tasks are a really impactful part of what we do in our day-to-day. So let's talk about that for a minute. Just clicking on the Tasks tab will list all the tasks related to that patient. You can see right here. And then going into that is as easy, and viewing those lab results is as easy as 1, 2, 3. And same with viewing documents that are in a task. So right here, we see the first task is these lab results for order 32. You can click on that arrow right there and it'll bring up that task. At the very bottom, you will see it says lab report, which means there's some lab results that are attached to this task. Click on lab report and right there it'll bring up all of your lab results. And we'll talk about where you can acknowledge that in a little bit. So again, if you clicked on, say the task was a document and you clicked on the arrow, that second screen, you follow the same steps, but that second screen, instead of lab report, it would say show doc for showing the document. You would click on that and then you would be able to view the document that's attached to the task. Again, as easy as 1, 2, 3, getting that information you need as quickly as possible. You can also view and manage your appointments. So again, right here, that calendar, it's going to show you your appointments for the day. You can click on that. You can also drag and drop your appointments, which is really exciting. And then from here, you can also see the various appointments that that patient will have. So you could click on Alberta Vivian or Barry Tevis, and right away it'll bring up, okay, so what are their upcoming appointments? Do they have anything? And have that information to talk to them about. So 3 important features. So any questions on that stuff, again, feel free right now to put them in the Q&A field and they'll get answered as soon as the webinar is over. So there's 3 really the features that I'm most excited about to share with you. So they're really important and they're unique to QMobile. They're different than what you can do in the EMR. So again, to make your day-to-day easier and smooth and run a little bit smoother. So first, QMobile gives you the ability to quote unquote scan your documents right on your phone. So you would click on the Scan Docs tab right here, click that plus sign, and you'll see right here on the right-hand side, it allows you to take a picture of a document right on your phone using your camera, and then it'll upload to the EMR when you refresh those liquid links. So no need to use a scanner, just a simple photo. You would click Use Photo and then click Save when that pop-up box comes. This is a huge time saver and allows you to scan things really quickly from your office in the room. Another really unique feature to QMobile we're excited about is this ability to dictate right into your phone. So when you are in an exam, you will see it will list all the exams that are there. A really cool thing is if there's already a recording attached to an exam, this microphone in this red box will be filled in. You'll see it will be a solid microphone. And that lets you know there's already a dictation in there. But you can add more. So then you click on this arrow and it'll bring up the actual exam note, and you'll see right at the bottom there, is the dictation button in the red. When you click on that, after you click this, an incredibly cool screen will pop up. You just start talking, the red bars at the bottom will move to show you that it is recording your voice. And when you are done, you click save. What you dictate in the app will be available as text in the EMR after you refresh the liquid links for that exam. So really, really cool feature. And right now we're working on an additional feature to dictation that will allow you to dictate into your phone and then insert that dictation into a patient record in the location of your choice. So not just in exams, but you can also put it in messages, or etc. It's really, really cool feature that we're going to, again, so many things, because it's a mobile app, we're able to fine tune and push updates and just keep making this a better product for you. Lastly, I want to talk about that's a great time saver is being able to call with one click. So not only can you call your patients, you see Alex James is shown here, you can just click on his phone number and that'll pop up and you can call. You can also call a pharmacy with one click. So you'll see in this demographic screen right here, you can see on the right side the subheading of pharmacy right under where it says problems. You can click on pharmacy, it'll have that pharmacy data, and you can press their phone number as well and it'll pop up and call. So again, making small day-to-day tasks a little bit easier can lead to a lot of increased efficiency overall. Just helping your day run smoother, taking things that can be a pain that shouldn't be, and making them happen easily with one click. So coming this weekend, I talked about some really cool capabilities that would be coming soon. We saw how to access patient records from the calendar, right? That launches this weekend. And we wanted to show you a few other impactful things being rolled out. So we talked briefly at the beginning of the webinar, but let's dig into this feature more. You can acknowledge the lab results. So we saw where you clicked on lab report and it came up with the lab results. And you can acknowledge them right from your task details screen. So you would click acknowledgement and this screen will pop up just like it does in the EMR. You can enter an internal comment here. You can also enter notes for the patient. And again, that will get uploaded into your EMR when you refresh your liquid links. And also, we've received a couple questions on how this looks actually in the EMR. So we will be posting that and some screenshots of the back end, how QMobile links to EMR in the Q&A document that we'll be loading onto our website as soon as this webinar is over. Also coming this weekend, hugely impactful, are nurse notes. You'll see there will be this new icon after this weekend called nurse notes. This is especially important for OB, as this is where the antepartum record, you can see right here, the antepartum record is stored and can be viewed in the hospital prior to the delivery. So again, just clicking that arrow and having this up, you'll be able to see that within your phone. Really, really fantastic. So you're so excited about this. You've seen all the features. We're excited about this. So if you are a cloud user already, if you are on our cloud, there is no cost associated with QMobile. All you have to do is reach out to support at incident@triarchhealth.com. You just let them know your EMR username and password and what your practice ID is, and they will set up a login for you into QMobile. And then you would just go to the App Store. Again, this is available on iPhone for our cloud users. So you would go to the App Store, not the Google Play Store, and download QMobile from there. If you are not on our cloud, but are interested, you want to be on the cloud, you want your system to be on the cloud, you want access to QMobile and other things we offer just for our cloud customers, please reach out to Patrick Murphy. He can go over the process of getting you on the cloud and also some of the pricing that goes along with uploading you to the cloud. Really, really great stuff. So again, you'd reach out to Patrick at pmurphy@triarchhealth.com. So all of this is done. You're on the cloud. You're able to get on. You go to that app store, and this is what the icon is going to look like. So just make sure it says QMobile. You'll see our Triarch Q icon. As usual, you would click on that. It'll download, and then you'll be able to log in using this screen. Again, you'd put in your username. This is after incident has set you up. You put in your username, password, and practice ID one time. And then if you go in and enable that Touch ID or that Face ID, you'll never have to enter this data again on the login screen. You will either, again, be able to use your thumbprint or your Face ID each time you open the app. Personally, I'm old school and I like the Touch ID. So I've been doing that and it works very quickly and very smoothly. As a quick recap to today's webinar, we covered a lot of stuff. There's a lot of things to be excited about. You can view patient records, medications, history, tasks. You can manage your appointments and manage the dictation. You can also upload photos of documents as your quote unquote scan docs. And you can call a patient or a pharmacy with one click. So again, all of these wins adding up to increase that overall efficiency, give you guys the mobility you really want and need in the office. If you have any questions and you haven't put them in the Q&A field, please feel free to reach out to me at Sarah Hermsen, shermsen@triarchhealth.com. And again, if you want to get on our cloud or are interested in any pricing for this, for the cloud, for anything else of our products, please reach out to Patrick Murphy, pmurphy@triarchhealth.com. Thank you so much for taking time out of your day for this webinar. Also email me if you have any ideas for a new webinar. If there's something that you really want to see, whether it's an overview or deep dive into a feature, a product, whatever you're interested in, please feel free to email Sarah Hermsen, shermsen@triarchhealth.com. Or when you're in Q College, you can click the Contact Us button at the top. You'll see a little mail icon, and you click that, and you can add any idea that you would like added to Q College or added for a webinar. So again, thank you so much for your time. Have a great Wednesday and happy fall, everyone. Talk to you soon.